Coming up on Arirang News, South Korea now has well over 1,000 cases of the coronavirus, more than 100 being reported day after day. It's claimed another life, too, bringing the death toll to 12. The virus has spread to 3 more countries in Europe, where Italy is still the worst off, now with 11 deaths. It's spreading fast in Iran, too, where the deputy health minister has been infected. And the coronavirus sends stocks on Wall Street plunging for a second day in a row, down around 3% across the board. We'll look at that situation in depth with an expert. It's 4:00 p.m. here in Seoul. Thanks for tuning in to Arirang News. I'm Devin Whiting. South Korea reported another death on Wednesday. The number of COVID-19 cases has broken the 1,000 mark now, 37 days since the first one was confirmed. These are mostly in or near the southeastern city of Daegu and are linked to a religious group called Shincheonji. For the details, we have our Lee Kyung-eun on the line. Kyung-eun, what's the latest?
Devin, South Korea has confirmed its 12th death from COVID-19 on Wednesday. The man, a 73-year-old from Daegu, had been receiving respiratory treatment in the city's Gaemyeong University Dongsan Hospital. He also reportedly had been suffering from chronic diseases like diabetes and hypertension. He's one of the members of the religious group Shincheonji, which is at the center of the massive number of cases over the past couple of days, which began with the 31st patient who was also from the particular group. And 253 more infections were confirmed on Tuesday, which brings the total number of cases to 1,146. The 1,000 mark, as you said, has been reached in just 37 days since the first case was confirmed on January 20th. Most of the cases are from Daegu and the southeast of the country. That includes Busan, which has confirmed 50 cases so far, with a major cluster there linked to a local church. And one nursing hospital in Busan is currently under a so-called cohort quarantine, meaning it has locked itself down. The measure came after one of the staff there was infected, and it was found today that another medical worker has contracted the virus from the hospital. No cases have been confirmed among patients, but some 24 of them with suspected symptoms are expected to be sent to Busan Medical Center.
Kyung-eun, obviously the situation's changing quickly day by day, but is there any pattern among the latest cases?
Yes, Devin. The Korea Centers for Disease Control and Prevention said that there are 2 notable trends. First is that the majority of the cases are coming from religious groups, as we've seen with the cases in Daegu and Busan. Second is that elderly people and those with pre-existing conditions are more prone to contract the virus. With that, the KCDC has highly advised people to refrain from engaging in group activities or going to public places, especially when they have some suspected symptoms like fever. Also, it is delivering the entire list of some 212,000 members of the Shincheonji religious group to municipal governments today for a thorough investigation. That's all I have for now. Back to you, Devin.
All right, Lee Kyung-eun reporting there. Thank you for that. And the coronavirus outbreak has spread to more European countries following a surge in Italy. As of Wednesday, Italian officials have reported 11 deaths and 323 confirmed cases. To control the outbreak, towns in the north of the country have been put on lockdown. And now Austria, Switzerland, and Croatia have all confirmed their first cases. Iran has confirmed at least 95 cases, with its death toll rising to 16, the highest outside of China. But in China itself, official figures seem to show the rise in new cases slowing down over the past week. On Wednesday, China confirmed 406 new cases, bringing the total infected there to some 78,000. The death toll in China has topped 2,700. The deputy health minister of Iran has tested positive for the coronavirus. Iran's suspected of having a far higher number of cases than it's reported, given that it already has the world's second highest death toll. The U.S., meanwhile, is working to build up its emergency supplies as it faces a likely shortage of face masks. Park Se-young has more.
After being seen coughing, sweating, and wiping his forehead during a news conference on Monday, Iran's Deputy Health Minister Iraj Harirchi has tested positive for the new coronavirus. He confirmed the news himself in a video clip published online.
I would like to inform you that I have been infected with coronavirus. I had a fever yesterday. My first test was positive last night, and I have isolated myself. They informed me a few minutes ago that my final test definitely is positive. I'm starting my treatment, and my general condition is not bad.
Iran's death toll from the virus rose to 16 as of Tuesday, the highest outside of mainland China. The country has become the epicenter of the disease in the Middle East with 95 confirmed cases so far. However, many have expressed concerns that Tehran is underreporting the true numbers. In the U.S., the Secretary of Health and Human Services said the country must prepare for more cases of the coronavirus, and it must build up its stockpile of protective gear for healthcare workers. He said the U.S. currently has about 30 million face masks, but experts suggest 300 million would be needed in a widespread outbreak. On Monday, the White House requested $2.5 billion in emergency funding to fight the virus. Park Se-young, Arirang News.
President Moon Jae-in will be sitting down with the leaders of South Korea's four main political parties this Friday to discuss the coronavirus. They're expected to share the latest developments regarding the outbreak and discuss measures to curb its spread. Likely on the table will also be ways to minimize damage to the economy, including the drawing up of a supplementary budget. It'll be the first meeting between the president and the political parties in 3 months. And to support efforts to contain the coronavirus, South Korea's Ministry of the Interior and Safety will release a special one-time grant of over $42 million. The ministry said Wednesday that the funds will be used to buy more diagnostic equipment. Of that money, over $8 million will be allocated to Daegu and $6.5 million to Gyeongsang-Bukdo Province, both designated as special management zones. The safety minister said local governments will use all means at their disposal to help until the outbreak is brought under control. The Chinese city of Weihai in Shandong province put more than 160 South Korean nationals in quarantine on Tuesday without giving any prior notice to the South Korean government. Seoul's top diplomat called the move excessive and unacceptable. Oh Jung-hee files this report from Seoul's foreign ministry.
Seoul's top diplomat has criticized the decision by a city in China to quarantine travelers from South Korea. On Tuesday, Weihai City in China's Shandong province announced it would isolate travelers coming from South Korea and Japan for 14 days. 163 travelers who left from South Korea, including 19 South Korean nationals, were all put in quarantine. Seoul was not given any prior notice about the measure. South Korea's Foreign Minister Kang Kyung-hwa, who's currently in Europe for international meetings, told reporters the measure is excessive and unacceptable, saying that it unconditionally bans the entry of travelers just because they came from South Korea. She added that China should consider South Korea's efforts. Currently, 16 countries, including Singapore, Vietnam, Iraq, and Israel, are blocking entry of travelers coming from South Korea. 11 countries, including Taiwan, Thailand, and Kazakhstan, have stepped up quarantine measures, isolating travelers or strengthening health checks. Seoul's foreign ministry invited foreign diplomatic missions from 103 countries on Tuesday. They explained that Seoul is doing its best to curb the spread of the virus and asked countries not to take excessive measures based on fear or misunderstandings about the situation in South Korea. Oh Jung-hee, Arirang News.
It's generally believed that with the coronavirus, the worst is yet to come. Some predictions by global experts say the virus will likely end up infecting most people in the world. In that case, it could become a seasonal illness like the flu. Our Choi Jung-yoon reports.
Public health experts have been trying to gauge how bad the coronavirus outbreak will get and whether it will become a full-blown pandemic by calculating the pathogen's reproduction rate. And according to a recent report by U.S.-based investment bank J.P. Morgan Chase, South Korea's coronavirus epidemic has not yet reached its peak. Taking the speed of secondary infections in China into account, the bank predicted that the epidemic could reach its climax in Korea around March 20th and said there could be as many as 10,000 confirmed cases. The bank supposed 3% of the 2.4 million people living in Daegu had been exposed to the virus. Daegu is where more than 80% of the total confirmed cases have occurred in Korea. However, the South Korean health authorities said it's too early to make such assumptions. Vice Health Minister Kim Kang-nip said at a briefing on Wednesday that more thorough statistical analysis needs to be done on the spread of the virus. Meanwhile, some say the virus will ultimately become uncontainable. In an article by The Atlantic, Harvard epidemiologist Mark Lipsitch said the coronavirus will be a global pandemic. with 40 to 70% of the world's population likely to be infected this year. But he clarified that by saying many of those people won't have severe illnesses or even show symptoms at all, which is already reportedly the case for many people who have tested positive for the coronavirus. In that way, it could have similarities with influenza, which is often life-threatening to elderly people or those with chronic health conditions, but causes no symptoms at all in around 14% of cases. This is leading to an emerging consensus that the outbreak will eventually morph into a new seasonal disease, which The Atlantic says could one day turn the cold and flu season into the cold and flu and COVID-19 season. 최정윤, Arirang News.
The World Health Organization has heaped praise on China over the way Beijing has dealt with the outbreak. To the surprise of many, the WHO even said the world needs to learn from the Chinese government's response. Lee Seung-jae reports.
The COVID-19 outbreak has affected scores of countries, including South Korea, which has seen the most confirmed cases outside of mainland China. Despite there being no end in sight, the World Health Organization has praised what it called China's strong and decisive approach to tackling the outbreak.
What they've done has only been possible because of a tremendous collective commitment and will of the Chinese people, from the most bottom-level community leaders we met and talked to the governors at the very top. It was an extraordinary, what we call all of government, all of society approach that many of you are feeling because you live here and you operate in this, but it is rare to see that.
According to the WHO's Director General, the decline in the number of confirmed cases in China gives hope to the rest of the world.
The team also estimates that the measures taken in China have averted a significant number of cases. But the key message that should give all countries hope, courage, and confidence is that this virus can be contained.
The WHO's decision to praise China has sparked global criticism given the Chinese government's lack of transparency, including initial attempts to censor reports of the outbreak. Others say that while China might be reporting a downturn, other parts of the world are now being hit hard by the virus that originated in the Chinese city of Wuhan. While the world braces for a widespread outbreak, the WHO maintains it's too early to call it a pandemic, as watchers continue to question the International Health Agency's credibility. Lee Seung-jae, Arirang News.
South Korea's response to the coronavirus outbreak is getting praise from international health experts. On Twitter, the former commissioner of the U.S. Food and Drug Administration, Scott Gottlieb, noted that some 20,000 people in South Korea will soon have their COVID-19 test results or already have them, and said this highlights what he called the country's significant diagnostic capability. A prominent MERS expert, Marianne Koopmans, retweeted data showing that South Korea has already tested tens of thousands of people, saying, wow. And a visiting scholar at George Mason University, Korea, Andre Abramian, told Time magazine that South Korea has a high diagnostic capability, a free press, and a democratically accountable system. Pessimism is rising sharply among South Korean companies as the coronavirus outbreak wreaks havoc on their business. The Bank of Korea says the overall Business Sentiment Index, or BSI, slumped to 65 this month, down a whopping 10 points from last month and the biggest monthly decline since January 2003. It's worse than during the MERS outbreak in June 2015, when the index recorded a monthly drop of 9 points. The index also sits at its lowest point since February 2016, when it slumped to 63. BSI among manufacturers tumbled 11 points on month, while the non-manufacturing index fell by 9 points. And Wall Street was down sharply again on Tuesday for a second day in a row, as health officials warned the virus will likely spread throughout the U.S. The Dow, the S&P, and the NASDAQ all closed around 3% lower. The Dow was down nearly 900 points to a little over 27,000, and the NASDAQ fell to 8,965. Oil prices continue to tank as well. Brent crude was down to $54 and West Texas Intermediate to just under $50. Time now for an in-depth look at the market news this afternoon, and for that I'm joined on the line by Dr. Song Soo-young, professor of economics at Jungang University. Professor Song, thank you for making time today.
Yeah, thank you, Devin.
So stocks on Wall Street plunging again on Tuesday as the coronavirus outbreak spreads. Korean stocks down significantly as well. What's the story in the stock markets today?
Yeah, currently the stock market has suffered from the outbreak, the spread, the more expanding spread of the coronavirus around the world, including some European countries, and also particularly in the United States, the Center of Disease Control has warned that coronavirus could start in the spread, could make a significant spread in the U.S. So that is why the stock market and also some bond markets has reflected those effect on that price. So particularly in Asia, but of interest is in the morning, the Shanghai actually index has been, now it is coming back to declining, but in the morning that the Shanghai index has been increased a little bit. So that might reflect in China, the situation has been improved, particularly the number of the confirmed cases has been declining in China. Whereas in Korea, right now, we are in the process of the increasing cases of coronavirus. But however, it will be stopped and it will be halted soon. But however, in the United States and other countries, we have to wait and see. That's why the market situation has reflected those complex and some tumultuous situation right now.
Well, we certainly do hope that it stops soon, but there's been volatility also in the exchange rate in the past couple of weeks. The won shot up to around 12.20 to the U.S. dollar, went down a bit yesterday, and now it's right back up there. So this is clearly the result of the coronavirus, but what's going on with the Korean won, and what's your outlook?
Yeah, clearly it can be explained well by the flight to quality, because when the economy has, although it has suffered, then the U.S. dollar is one of the most favorite place to find a shelter as some safe, and that's why the U.S. dollar's price is getting increased, and the value is much higher. But when I see the gold price, there is some mix in the market. Still, the uncertainty is too large. That's why there is some mixed situation is still continues. However, when I see the futures, particularly the expectation among the investors in the future, particularly for the commodities, the oil price, oil futures value is declining, which means that the oil is not anymore popular in the future. And there is the S&P 500 futures. Also, there is some kind of gain, which means that S&P 500 and the Dow Jones Industrial Average could be better in the future. Whereas gold is already in the futures of the gold, so it's declining. So that situation is mixed up. So right now we do not make some hasty estimation of the future, but we have to see what the development of the situation.
Yeah, mixed signals, as you say. Oil prices seeming to indicate the impact on the global economy and how it's hit demand for oil in countries like China. But tomorrow, in view of all this, the Bank of Korea is going to decide on interest rates, and it seems that there's some pressure on it to cut rates. What do you think the chances are of a rate cut?
Yeah, right now, when I see the My News that was announced and published in the last November and early January, the situation is there are two of the members of the Monetary Policy Board has preferred some kind of lowering of the base interest rate for Korea. Right now, after that, in February, the situation is getting worse because of the outbreak of the coronavirus spread around our country. Therefore, the situation indicates that we most likely to decrease the interest rate to relieve the burden of some interest costs, particularly the loan. But however, this we have to worry about, or sterilization policy is necessary for the lower the loan interest that could spur the real estate market. Therefore, the government should use very micro prudential policy and pinpoint then whether the borrowers are eligible or not. And also how those monies and the loans are used. So they have to. The government must remain very alert about whether particularly the household market. Because of the balloon effect is still prevalent in the Korean real estate market, but as a result, we have to watch over all the countries, not just some specific areas such as Seoul or some vicinities of Seoul and the Gyeonggi province. Then we have to see what is the development of the house real estate market in the near future. But currently, I anticipate the Bank of Korea to decline the base rate by 25 basis points. That is really plausible and good for the economy.
All right, we'll be watching that situation very closely. An interesting point about the housing market and the policy there. We'll see what happens tomorrow. Thank you, Professor Song. We appreciate it.
Thank you.
And the South Korean government has temporarily closed kindergartens and schools across the country. That's left working parents struggling to find places that can take care of their kids. Our Ji-young files this report.
Amid the COVID-19 outbreak, childcare has become a pressing issue for working parents in South Korea.
Classes where my first child attends have closed indefinitely, and other private educational institutes that my children go to have shut for up to a week. So I had to go to Daejeon to drop them off at my parents-in-law's house.
Another working mom said she was sad because she was forced to miss a meaningful event she had been looking forward to.
My child's graduation ceremony was canceled when it should have been celebrated. I know the cancellation was inevitable, but it was really sad because it got called off so abruptly.
She added the outbreak is driving her to buy products online due to the rapid uptick in the number of COVID-19 cases.
Because we don't know when this will end, myself and other moms keep buying products online.
The government recently suspended classes at kindergartens and schools nationwide and postponed the start of the semester to March 9th. It also advised other organizations visited regularly by children to close temporarily amid concerns the virus could strike the younger population. Many kindergartens, daycare centers, and private educational institutes across South Korea are closed due to the outbreak, but they're running emergency operations to help working people who are in desperate need of childcare. The head of a daycare center in Suwon, Gyeonggi-do province said her business is doing its utmost in terms of hygiene control. However, some parents are worried that they'll inevitably have to send their children to the daycare center when other parents keep their children at home. She also expressed concerns about the difficulties her daycare center is experiencing.
We hired new teachers to ensure a good children-teacher ratio, but because many children are staying at home, my new teachers cannot start working.
She added many parents worry they might not be able to go back to work if this outbreak lasts an extended period of time.
엄지영, 아리랑 뉴스.
And that brings us to the end of this newscast. Thank you for watching. More live news coming your way at 7 p.m. Korea time.